think we'll go ahead and get started. Before we do, some housekeeping items. Any questions you have during the presentation or at the end, you can ask by hitting either the chat button or the Q&A button at the bottom of your Zoom window. Tyler and I will be watching those questions, and we'll be making sure Sam gets those questions answered. And so, with that, let me introduce our presenter today, Sam Olson. Sam Olson is the founder of Sam Olson Insurance Services and a trusted Medicare expert serving Napa Valley and beyond. Since 2019, Sam has helped seniors navigate Medicare with clarity and confidence, offering personalized guidance through over 20 carriers. His dedication has earned him accolades like Best Insurance Company in Napa County in 23, 24, and 25.
Hat trick.
He is also a featured Medicare contributor for Napa Spotlight magazine and an active community leader with the Rotary Club of North Napa. And Sam is also a personal friend of mine. And Sam's wife and I were high school friends. So that's kind of the connection there. And I think with that, Sam, please take it away.
Yeah, well, thank you, Andrew, and thank you for having me. It's also worth mentioning I am a Bakersfield native, so there's a lot of Napa in there, but yeah, born and raised in Bakersfield, and I do miss Bakersfield, but I do not miss the heat. Grateful to be up here, but Andrew still convinces me to come down a few times a year, and happy to serve the clients down there as well. Um, so today we're going to be talking about Medicare and. There's been a lot in the news about Medicare and Social Security, and it's a little bit daunting for a lot of folks because they don't know what to believe, what's true and what's not. But that's essentially what we do is we guide you through that entire process. A few notes. First of all, I have to mention that this is an educational Medicare seminar. It's not a marketing seminar. We're not here presenting specific products. If you have a question about a specific product, we can talk about that at a later time. But this is more general information. The annual enrollment period, annual election period, begins October 15th. So it's right around the corner and it ends on December 7th. And so as long as you make a decision by December 7th, you'll be set up for the following year. Um, this next year is probably going to be one of the most, volatile, or I guess you could say one of the years that has the most changes with Medicare, especially if you have a Medicare Advantage plan, or a drug plan, and most people have a drug plan. So we're going to see some significant changes there. And we're going to talk about what are the changes you can make. So, as I mentioned, October 15th is the start date, but the plan information will be available on Medicare.gov as soon as October 1st. So if you log in at 12:01 in the morning, you'll be able to see the new plan information. And so a little bit about me. Andrew already mentioned most of this. Um, I started getting involved with Medicare in 2017, and many of you in Bakersfield have probably have heard the name Paul Sheldon, and I shadowed him for about a year and a half, and that's how I got, into the business. And so, um, Paul was my little league baseball coach, and his son was in my wedding. He was my best man in my wedding. So that's kind of how this got started. And I got a little cocky and said, you know what? I can do this on my own. And so I started my own company in 2019 here in Napa. We're now representing over 30 insurance carriers, and we go way beyond Napa. We're now licensed in 25 states, and we continue to add them as the needs arise. And so if you're new to Medicare, this is kind of the general process that we take our clients through. And then if you're also already on Medicare, there's definitely points along the way that are the same. And so the first is actually figuring out, does the client need Medicare? Because turning 65 doesn't mean you should go on to Medicare, right? You may have an excellent group plan and you could delay Medicare potentially as long as you qualify, and we help the client figure that out. But if we determine that going on to Medicare is it is the right time for them to do that, then we move on to step number two, which is kind of the core of what we do, which is education, right? And this is the same with Entruity, where we're trying to educate folks so that way you understand what the different paths to Medicare are, what these different terms mean. And it's a really difficult time turning 65 because you're being bombarded with information with respect to Medicare, right? You're getting all these flyers in the mail, you're seeing all this stuff on Instagram, social media, whatever it may be. Oh, and the phone calls, which really aren't supposed to be happening, by the way, but they do. And they're constantly trying to sell you a specific path to Medicare, whether or not that path is good for you, right? And so that's where we come in. We talk about the different paths to Medicare, what the different terms mean, what this means today, for the next year, what that health plan is going to mean, and also 10 years down the road, right? Because we can't just think about, the near future. We need to think about what things might look like later on. After we've done that, then we talk about supplemental options. And so we walk you through the options that apply to you. And by the way, before we even meet, we have you complete a questionnaire that really helps us understand your situation. So we're all ready to go by the time we have our meeting and we have everything laid out and give you a few options to choose from. Step number four, I put this on its own because I feel that it's one of the more complex parts to Medicare, and that's also known as Part D, which is the drug plan. And currently there are 16 different drug plans in California, and if you're in a different state, it could vary a little bit. But these drug plans all have a different list of medications that they cover, right? And so we have to figure out which plan is the best for you. And then there's also, I'll talk about this a little bit more later. Believe it or not, purchasing all the medications through insurance may not be the best idea. And so we help you figure that piece out as well. And so it's my belief that if Medicare is done correctly every year, it is the one of the best insurance programs that is offered in the United States. But it does need to be done correctly. And so talking about education, we'll do a little bit today. And this is probably the biggest decision you would make as a Medicare beneficiary, whether you're getting ready to go on to Medicare or you're already on Medicare. And that is whether or not you go with a Medicare Advantage plan or a supplemental plan. And unfortunately, it seems that a lot of people think they're the same, and they're not. There's some significant differences, and it's ultimately two different paths. And so, you see there on the Medicare Advantage side, it says HMO, and that's true. Most of these are network-based plans. And if you don't know what that is, that means you have to stay within that network to get services, and they are in charge of your benefits. They control whether or not a service is approved, and that through a process called prior authorization. And so when you sign up for a Medicare Advantage plan, essentially what's happening is they are taking over your Medicare Part A and B benefits, right? And unfortunately, what we see with all these advertisements is they're always talking about the perks, but they never talk about a lot of the pitfalls. And the perks can include, they're going to include your medications, they'll give you free rides to your doctor's appointments, they'll shine your shoes, wash your car, whatever it takes to get you to enroll into that plan. And they're extremely enticing because a lot of times, and most of the time, the premium, what you pay on a monthly basis, is zero. But when you actually utilize the plan, the out-of-pocket maximum next year can be over $9,000 a year. So that zero premium was nice, but it could end up costing you more in the end. And so On the flip side, Medicare supplement, um, there really isn't a HMO or a PPO network. A lot of people call them PPOs because they have more flexibility, but in my opinion, they're better than a PPO. And the reason is Medicare is your network. So if the doctor accepts Medicare, the supplemental plan is accepted, regardless of who the insurance carrier is for that plan. And the question I always get is, well, how many doctors accept Medicare? The stats vary a little bit, but it's between 88 and 92%, somewhere in there. So just call it 90%. And that means you can go to any Medicare doctor in the US that accepts Medicare and your supplemental plan is accepted. Now, referrals are not required with a supplemental plan. The premium is higher compared to an Advantage plan, but if you go with a Plan G, in 2025, the maximum out of pocket is $257 a year. So that's a lot better than that, $9,000. Extras aren't that common with Advantage, or sorry, with supplemental plans. And so some people go, oh, well, I don't get these extras, but you got to remember, we want to make sure that the health insurance is paying for your medical bills. And so, but the key point here, and what do I mean by that last point is Medicare remains primary. And the reason that is a good thing is because, experience has shown us that Medicare is far more generous compared to an insurance company, a typical insurance company. So if Medicare approves the claim and the requirement is if it's medically necessary, they're going to approve it, then the supplemental plan has to approve it. Whereas on the Advantage plan side, the insurance company is primary and they're the ones in charge of approving and denying claims. And all the stuff you've seen in the news about denial claims with companies, that's kind of goes in this category of Medicare Advantage. All right. So before I move on, were there any questions that popped up?
I haven't seen any come through.
Nope, not yet.
Okay, well, hopefully everyone's still awake. So there are going to be changes in 2026 if you have an Advantage plan. And the biggest thing is they're not receiving as much funding this year. There's a cut of about $25 billion. And so we're going to see a lot of those extras go away. There will be companies still offering those to be competitive, but they may, trim it off somewhere else, right? They may increase the premium. We're probably going to see less zero premium plans. They're going to increase the out-of-pocket maximums, the deductibles and copays. And then they're also removing a lot of key medications off their formularies. And so we're going to see a lot of disruption. And then if you have one of these plans right now, you want to make sure you review your annual notice of change, which should arrive in your mailbox by September 30th. And this will tell you what changes, if any, are going to occur. And it could also be the case that they're going to flat out cancel the plan. So you definitely want to keep an eye out for that notice. And there's some reasons to this. These increased costs. Number one, it's that funding issue, but there's also been an extreme rise in costs for medical. I've been on lots of webinars with all these insurance companies, and they've all said they've been experiencing a unusual amount of claims compared to the past. And a part of that has to do with COVID. Um, you know, a lot of people put off elective surgeries during that time, either because the surgery centers were closed or they were just too scared to go into the hospital and, they were afraid of getting sick. And so that kind of delayed those surgeries. And now people are starting to go back and we're now seeing a huge increase in those surgeries. Medical costs in general have just increased by at least 8%. And then an interesting one is the use of GLP-1. So that would be like a Mounjaro or Ozempic. Um, and insurance companies are paying for this if you're diabetic and or have a heart condition. And so it's helped a lot of folks, lose weight. But there is a significant cost to GLP-1s. And then on the right-hand side are ones I've already mentioned. We're going to see, this is a $45 billion reduction, but The government did inject another 25 million, so it's roughly 20 million or 20 billion rather that they're not going to have any longer. So that's where we're going to see that decrease in a lot of those benefits. So what can you do if you have one of these plans? Well, you can shop the market to see if there is a plan that would suit your needs better. And that's something we can help you do, or you can go on the Medicare.gov website to compare that yourself as well. And again, I'm not saying that all of the extras are going to go away, but we will definitely see a reduction. So you can shop and see, is this other plan going to be better for me next year? The other option, which is, if you can't tell, would be our favorite, and that is going back to original Medicare and getting a supplement. And the reason is, you might do that is a lot of the headaches that you might experience with Advantage plans would go away with a Medicare supplement. But unless if you have an exception, and I'll talk about that here in a second, your acceptance into a Medigap, also known as a Medicare supplement plan, is not guaranteed. It is an Advantage plan, right? If you're just changing to another Advantage plan, that's no problem. But with a supplement, you have to medically qualify. And I'll stop right here because this is important, because if you're in an Advantage plan right now and you are healthy, it's a great time to consider going back to original Medicare and getting a supplement, because you can medically qualify right now. Whereas if you get frustrated with the plan in the future, you may not be able to qualify. And every year we get lots of calls of people wanting to get out of the Advantage plan. And the reason is usually because they're dealing with health problems and the insurance company is giving them hassle with prior authorizations and network problems and stuff like that. And they're having this frustrations because they're dealing with medical issues, and the supplemental plan goes, sorry, you have medical problems, we're not going to take you. So again, I would strongly consider moving back to original Medicare if you're in good health. Now you may go maybe thinking, okay, I've got some health problems going on. Don't assume that you won't qualify. Reach out to us and we can let you know. You don't need to be an athlete by any means, but there are definitely some situations where it's an automatic denial. Lastly, you can stay with the plan. If it's still being offered next year, you're happy with it, and there hasn't been significant changes to the plan, then you can move forward and you don't need to take any action. You just roll on over to the next year. Okay, so that was Medicare Advantage. If you have original Medicare with a supplement, that means you more than likely have a prescription drug plan. And there's some good news still at play here with drug plans. Last year, the annual maximum that you would spend, or sorry, this year really, that you would spend on medications is $2,000, which helped out a lot of our clients. Some of them were spending over $5,000 a year just on medications in the past. And so that was capped by the government at 2,000. It's going up next year, $100, so basically the same. What's also held is that you may have heard of something called the donut hole, or the catastrophic phase of a drug plan, which was a period of time. If you reach a certain dollar amount, you would have to pay significantly more for your drugs. That is still eliminated. And then if money is kind of tight and you can't pay for the medications up front, because what happens is you usually have to meet a deductible first, and you may have larger copays in the beginning. You can actually spread that out evenly over 12 months. And there's no interest on that or anything like that. So that still exists. It's called the Medicare payment plan. Bad news is in that fourth corner is that we are seeing a lot of increases with these drug plans. There are still two drug plans that are going to be very competitive next year, but the rest of them, some of them have increased their premiums by $50 a month, $100 a month, which is basically them saying, hey, we want you to move on. And so again, very important to look at your annual notice of change to see if your premium is going up on your drug plan. Now, what is the process that we go through to help you figure out the right drug plan? And the first might be the obvious one, but it's making sure that we have all of your medications. You can't leave one out. That can throw off the whole equation, and it could end up being the wrong drug plan for you if we don't have all of those meds. So, if we're doing this over the phone, I just ask the clients to pull out all of their meds and read them straight from the label, and that way we make sure we get them all. And then two is, if you're doing this yourself, you can go to Medicare.gov. They have a great comparison tool on there, and you enter in all of those medications, and you also need to enter in the pharmacies. And don't just enter the pharmacy you love going to, unless if you're absolutely married to it. Medicare allows you to enter five, and the reason this is so important is because just going from one pharmacy to another could dramatically save you money, sometimes 500 bucks a year, 1,000 bucks a year, or more. And so I hate to see people overpay for medications just by going, to the wrong pharmacy. So definitely add five different options in there. Put some of the bigger names in there, like Walgreens, CVS, Costco, because those are going to usually provide the best price. Sometimes you'll see that the mom and pop shop is just as competitive, and if you want to continue to go there, that's great. Step three, and this is where I think we provide a lot of value to our clients, is exploring options outside of the drug plan. There are medications that we know when we see them right away, do not include it in the drug plan because it's going to cost you a lot more. Um, and we utilize other sources such as GoodRx. You probably have heard of that. Or costplusdrugs.com. This is Mark Cuban's mail order pharmacy. He's been extremely competitive on medications, and a lot of my clients have saved a ton of money by utilizing that for some of these meds. And then we also use international pharmacies. There's a wonderful tool called pharmacychecker.com, and they vet out all of the international pharmacies and to make sure that they're holding to high standards. Otherwise, they can't sell on that platform. And there's certain medications like Eliquis you can get for a fraction of the price that you can here in the U.S. Now, there is a little tariff situation going on. I don't know if you've heard, and I'm not an expert in that area, so please don't ask me about that. But as of right now, it's more expensive to get meds in Canada. We've been told that that's going to be removed. We'll see until we have more information. I'm not sure. So. And then step four is, something we put together what I would call an actionable plan, right? If I'm having you get a medication from Canada and then using GoodRx for this other one, and you have to go to three different pharmacies, you just give up, right? And so we put something together that is as simplified as possible, but still saves you the most amount of money. All right. So here's a quick example. Three medications that we commonly see. And what I've done here is I've ranked these by annual cost. And I apologize, this is a little bit outdated, but the illustration still stands true is that, if you were to purchase all of your meds through the drug plan with those particular medications, the least expensive plan option would be over $3,300. But by, purchasing, just one of those meds outside of the drug plan, it cuts the price by about half. And sometimes we see somebody spending $2,000 and it gets cut down to $500 by making some of these changes. So, and please know I'm not here advocating for any of these particular drug plan companies. It's just, this is an old illustration anyways. Some of these plans aren't available, but that's a part of what we do there. So, the last topic is the supplemental plans. And this here is a chart that tells you what all the different plans offer, right? And I won't go into the weeds on this, but we help you work through this to figure out which plan makes the most sense. Most people today are enrolling into Plan G. And people tend to love this plan because your out-of-pocket max is only $257 a year. It used to be that everybody had Plan F. And if you still have this plan, you may have noticed a significant price increase on this plan, and that's because the government's not allowing new people to enter this pool of Plan F. And the insurance companies have to compensate for the risk, so they increase the rates. Plan N is kind of a step down from G. If you're looking to save a little bit of money, this can help you. Um, and we could talk more about that in detail later. But here's an example, and we see this happen all the time. This is a more recent example, actually. The customer and her husband were in a Plan J, and this is just like Plan F. It's not available any longer. And for one person, they were spending $548 a month. And if you're wondering what J is, it's very similar to F. No out of pocket. It was an awesome plan at the time. But the problem is the price. And what we did was we switched them to a different carrier, the different plan, which is just a slight step down. The only difference is there's an annual deductible of $257 a year. And just for one partner, they were able to save $3,540. Or sorry, $2,796. And so almost $6,000 a year between the two of them. And so if you have a supplement, there's a couple of times you can change. One is within 60 days of your birthday. That's called the California birthday rule if you're a California resident. And that allows you to change your supplemental plan without any medical underwriting. The other time you can change is anytime. You just have to medically qualify, and we'll help figure out if you can do that. Okay. So if you're wondering how to work with our team, we'll have a link at the end or QR code, and Tyler's going to send out a scheduling link as well. But you can schedule an appointment directly on our calendar. And once you schedule the appointment, you'll be automatically prompted to complete a questionnaire. And again, this just helps us figure out your situation and see if we can help. And then if we figure that we can help you, we'll let you know one way or another, and then we'll go ahead and go forward with the meeting. And typical meetings are done by Zoom or by phone. And I will have a couple of days in Bakersfield too, so we could possibly schedule at that time as well. And then if you like our recommendation, we go ahead and get you enrolled. If you want some time to think about it, we just schedule a future appointment and take care of it then. And so, what is the cost to work with us? We get this question all the time, and it's the easiest answer ever: zero. We do not charge for our services, but we provide year-round support for anything related to Medicare, anything on this checklist here. And the way we get paid is through the insurance companies. They pay us a commission to sell their products. And so that's all I have for today. Those are all the states we're licensed in. And if you want to schedule an appointment, you can do so by scanning that code, and then we'll also send out a link. That's all I have. Are there any questions?
Yeah, we do have a question. Someone would like to know how soon before turning 65 should someone schedule an appointment with you to enroll?
It's a great question. So, 3 months before your 65th birthday month, um, unless if you're in the rare case that your birthday's on the first of the month, then you start 1 month earlier. So, it'd be 4 months, but 3 months before would be ideal.
Perfect. And just kind of thinking, if someone's already set up with Medicare, they have everything put in place for them, probably wouldn't be a bad idea to still connect with you, right? And have you go over everything and see where they're at.
Yep, that's correct. And those appointments will be in October, and it's just a good play, checkpoint to see if you're on the right path.
Awesome.
Sam, you had mentioned that there are two times to change supplement companies. One, if you're a California resident around your birthday, and two, anytime going through medical underwriting. But isn't changing through the annual enrollment period? Do you still have to go through underwriting at that time?
It's a great question. So if you have a supplement, the annual enrollment period actually doesn't apply at all. It only applies to Medicare Advantage and Part D drug plans.
Oh, okay.
So even if we're in the enrollment period and you have a supplement you want to change and you're not in that birthday window, you have to answer health questions.
Okay.
So, but I don't want to scare people away with that because I just had a 90-year-old lady pass. So, it can still be done, and we're aware of what carriers will accept what and, all that too. So, but yeah.
Sam, it looks like we have another question come in. When will you be in Bakersfield for appointments?
Good question. So I'm going to be, hold on, I forget. So it's going to be October 17th, which I think is a Saturday, and then also the following Monday. And then I think we're going to schedule, and I'll get with you, Andrew, um, to schedule another time for me to be down there as well.
Okay. Looks like the 17th is a Friday, so maybe that.
Friday. Okay, I'm definitely, yeah, I'll be there Friday, Saturday, and then Monday as well.
Okay. So maybe the 18th through the 20th, sometime in there.
Yep.
17th through the 20th.
Perfect.
Hi, Leanne. Good to see you're on here.
Okay, well, let's see. Oh, and real quick, will Medicare cover someone if they're traveling outside the US?
Great question. So, Medicare does not at all. What what will cover you is the supplemental plan. You get, if you have a plan G or plan N, they will give you a lifetime maximum of $50,000 if it's an emergency within the first 60 days. So, um, I highly recommend getting a travel policy. They're really cheap and they'll give you $1 million of coverage. And it's like usually like $10 a day or something like that. So definitely worth the peace of mind.
Awesome. Okay. And when you are in town, will it be here at our office at Entruity?
Uh,
Bradley would like to know.
is that okay, Brad?
I think we can assume yes.
Okay.
So
Yeah.
Sam, really the benefit of working with you is you can help guide clients on the do we go Advantage route? Do we go original Medicare with a supplement route? And then navigate which insurance companies are, good earners of their premium dollars, which insurance carrier should they choose, which Medicare plan should they choose, and ultimately which drug plan they should choose. And you're kind of their guide throughout that whole process. Is that a fair statement?
Yep, you nailed that. So it's exactly what we do and the reason we do it. So um yeah, it's a kind of a confusing mess. And so it's not to say that you couldn't do it on your own, but there's a lot of nuances and differences in these different plans. So
Very good. Any other questions?
all right.
Does it?
Excellent. Well, Sam, thank you for your presentation. I think that was really great talking about some of the big changes that are coming next year for Medicare Advantage and drug plans. any follow-up questions, you can email us or Sam directly if you know his email. And Tyler will be following up with an email to all.
Yep. Yeah, once this recording is done and we get it put up on our website, we'll be sending it out to everybody, and we'll send the link for Sam, and we'll make sure everybody gets that. So
Excellent. So you'll be hearing from us, and use Sam as a resource. We've met with many of our clients. We've introduced them to Sam, and Sam's been able to save our clients a lot of money. I think probably the biggest savings story was something like $8 or $9 grand a year we saved someone. So if you have any questions, I would recommend, Brad would recommend, talk to Sam, and he can help you make sense of it and probably find some money to be saved. So thanks again, everyone. I think we'll stop it here, and appreciate you joining us and wish you a great rest of your day. Thank you so much.
bye, everybody.